Generalized anxiety disorder is an mental health condition Look at this picture shows that signs and symptoms excessive worry, restlessness, difficulty concentrating. Look at this irritability, detail going on. Introduction. Generalized anxiety disorder is a common mental health condition characterized by persistent, excessive, and uncontrolled worry about everyday events. The anxiety is disproportionate to the actual situation and interferes with daily functioning, social life, and overall well-being. Definition. Generalized anxiety disorder is a chronic psychiatric condition marked by excessive anxiety and worry occurring more days than not for at least 6 months about various activities or events accompanied by physical and psychological symptoms. Etymology. Generalized means affecting many aspects of life. Anxiety from Latin anxietus meaning distress or uneasiness. Disorder disruption of normal mental function. Epidemiology lifetime prevalence 3 to 6 percentage worldwide. More common in women than men. 2:1 ratio. Usually begins in late adolescence or early adulthood. Often underdiagnosed in primary care settings. Types. GAD is not formally divided into subtypes but may be categorized clinically as 1. Mild GAD, 2. Moderate GAD, 3. Severe GAD, 4. GAD with comorbid depression, 5. GAD with substance use disorder. Causes. 1. Neurochemical imbalance, serotonin, norepinephrine, GABA. 2. Genetic predisposition. 3. Chronic stress. 4. Traumatic life events. 5. Maladaptive thoughts patterns. Risk factors. 1. Family history of anxiety disorder. 2. Female gender. 3. Childhood trauma or abuse. 4. Chronic illness. 5. Substance abuse. 6. Personality traits. Example, perfectionism. Complications. 1. Major depressive disorder. 2. Substance abuse. 3. Sleep disorders. 4. Impaired social and occupational functioning. 5. Increased risk of cardiovascular diseases. Pathophysiology. Pathophysiology of generalized anxiety disorder, step by step. Step 1. Genetic and environmental predisposition. Individual has a genetic vulnerability to anxiety disorder. Exposure to chronic stress, trauma, or adverse life events activities this vulnerability. Step 2. Stress perception and cognitive appraisal. Stressful stimuli are misinterpreted as threatening. The brain shows heightened sensitivity to perceived danger even in non-threatening situations. Step 3. Hyperactivation of amygdala. The amygdala, fear center of the brain, become overactive. Normal fear responses become exaggerated and persistent. Inability to properly turn off fear responses. Step 4. Impaired professional context regulation. The professional context which normally control emotional responses become less effective. Reduced ability to rationalize, control worry, and suppresses fear. Step 5. Neurotransmitter imbalance. Decreased GABA activity, reduced inhibitory control, increased anxiety. Serotonin dysfunction, poor mood regulation, and increased worry. Norepinephrine excess, heightened arousal, vigilance, and autonomic symptoms. Step 6. Hypothalamic pituitary adrenal HPA axis dysregulation. Chronic stress activates the HPA axis. Excessive relief of corticotrophin released hormone CRH. Adrenocorticotropic hormone ACTH. Cortisol. Persistent cortisol elevation causes sustained anxiety and somatic symptoms. Step 7, autonomic nervous system overactivity. Sympathetic nervous system become dominant, leads to physical symptoms, palpitations, sweating, muscle tension. Tremors, gastrointestinal disturbances. Step 8, behavioral and cognitive reinforcement. Avoidance behavior temporarily reduce anxiety. The reinforces maladaptive coping, strengthening the anxiety cycle. Worry becomes habitual and uncontrollable. Step 9, chronicity and functional impairment. Ongoing neurobiological dysregulation leads to persistent anxiety, sleep disturbances. Fatigue, difficulty concentrating, result in social, occupational, and emotional impairment. Summary flow chart, genetic and stress factor, treat, misperception, amygdala hyperactivity, reduced prefrontal control, neurotransmitter imbalance, HB axis overactivation, autonomic symptoms, chronic anxiety and impairment. Stages 1. Initial worry, excessive concern begins. 2. Persistent anxiety, worry becomes chronic. 3. Physical symptoms, somatic complaints develop. 4. Functional impairment affects daily activities. 5. Chronic disorder, long term symptoms without treatment. Signs and symptoms: psychological, excessive worry, restlessness, difficulty concentrating, irritability, fear of losing control. Physical symptom: muscle tension, fatigue, palpitations, sweating, sleep disturbances, gastrointestinal discomfort. Medical diagnosis based on DSM-5 criteria including excessive anxiety for more than 6 months, difficulty controlling worry, at least 3 associated symptoms, symptoms cause distress or impairment, assessment tools, GAD 7 scale, Hamilton Anxiety Rating Scale, nursing diagnosis. 1. Anxiety related to perceived threat. 2. Ineffective coping. 3. Disturbed sleep pattern. 4. Impaired social interaction. 5. Powerlessness. Medical management. 1. Selective serotonin reuptake inhibitors SSRIs. 2. Serotonin norepinephrine reuptake inhibitors SNRIs. 3. Benzodiazepines short term use. 4. Bisphrin. Nursing management. 1. Establish therapeutic communication. 2. Encourage expression of feelings. 3. Teach relaxation techniques. 4. Monitor medication adherence and side effects. 5. Promote healthy sleep and nutrition. Treatment option. 1. Pharmacotherapy. 2. Cognitive behavioral therapy. 3. Mindfulness based therapy. 4. Lifestyle modification. 5. Combination therapy. Medication plus psychotherapy. Psychosocial medicine. 1. Cognitive behavioral therapy CBT. 2. Stress management training. 3. Relaxation therapy. Deep breathing. Progressive muscle relaxation. 4. Support groups. 5. Psychoeducation for patient and family. Prevention. 1. Early identification and treatment. 2. Stress management techniques. 3. Healthy coping strategies. 4. Avoidance of substance abuse. 5. Regular mental health screening. In conclusion, generalized anxiety disorder is a chronic yet treatable condition. Early diagnosis, appropriate medical and nursing interventions, and psychosocial support significantly improve patient outcomes and quality of life. A multidisciplinary approach is essential for effective management. Thank you. Have a nice day.